Hello, everyone. Welcome. Saludos. And thank you for joining us. Today kicks off our Community Engagement in Research webinar series. And this series is hosted by the Juan Antonio Corregel Puerto Rican Cultural Center of Chicago. The session is developed with resources that are reported and supported by funding from the network of the National Library of Medicine. The sessions throughout the series will provide health education information and resources. Today's webinar specifically discusses the role of community health workers or promotoras as community researchers to promote equitable research, outreach, recruitment of diverse study participants for clinical, behavioral, and patient-centered research. We are joined by Brenda Lee Rodriguez, who will define the role of promotoras and offer strategies that we can all hopefully start implementing in terms of finding and securing funding, like PCORI funding, to train community health workers to conduct community research. Bienvenidos again, mi gente. My name is Lisa Ponte Soto. I'm the founding president and CEO of Tanoma Consulting, the moderator of today's webinar session and series. I am a health equities researcher and evaluator trained in public health, community participatory, culturally and linguistically appropriate practices. Tanoma Consulting is a national nonprofit consulting firm providing transformative, culturally responsive research, evaluation, and training services to advance health, education, and workforce equity. And you can visit us at www.tanomaconsulting.com for more information. Before we begin, please note that we will leave a few minutes at the end of the session for Q&A. So if you have any questions, please enter those in the chat. Throughout the session, we'll be tracking those and making sure that your questions get responded to. Also, feel free to share any comments that you may have or resources. If you have upcoming events, we want to know about those as well, so please share. Also, you can follow along the conversation on Twitter. You can use the hashtags, hashtag AllOfUsResearch or hashtag PRCC Chicago. Or you can tag us on Twitter at JACPRCC or at AllOfUsResearch. We are also streaming this session live on Facebook, so you can follow us there as well if you prefer. Before we begin, we also wanted to share information about our partners for this initiative. The Illinois Precision Medicine Consortium for All of Us is comprised of 6 Chicago-based medical centers. The Puerto Rican Agenda of Chicago, a nonprofit organization comprised of local Puerto Rican leaders ensuring the self-determination of Puerto Ricans in Chicago throughout the diaspora and in Puerto Rico through policy and advocacy. The Chula Vista Community Collaborative that you will learn more about in a few moments, and the Chicago, Illinois chapter of National Hispanic Nurses Association. Also, Illinois Unidos, a consortium of Latinos addressing inequities due to the impact of COVID-19 in Latino communities and beyond, an initiative that I'm very proud to be a part of. This program is hosted by the Puerto Rican Cultural Center. The center was founded in 1973. And the Puerto Rican Cultural Center of Chicago is a community-based grassroots educational, health, and cultural services organization founded on the principles of self-determination, self-actualization, and self-sufficiency that is activist-oriented. Without further ado, it is my esteemed pleasure to introduce to you our speaker, our featured speaker for today, Ms. Brenda Lee Rodriguez, the director of Chula Vista Community Collaborative. Brenda Lee is a recipient of the 2017 Community Advocate Award by the Latino Center on Aging and the 2012 Sunshine Health Education Champion Award for the South Florida Hispanic Chamber of Commerce. Brenda Lee currently leads the Chula Vista Community Collaborative near San Diego, California, operating 5 family resource centers in the area. Previously, she was named the Community and Stakeholder Engagement for the Clinical and Translational Science Institute, among other programs during her 18-year tenure at the University of Miami. Simultaneously, she served as adjunct communication studies faculty at the Miami-Dade College for 5 years. Over the past 25 years, Brenda Lee has been building experience in developing and administering community-based interventions to address health disparities in the US and Australia. She routinely provides technical assistance and volunteers at several regional and state and national committees. Thank you, Brenda, for joining us today. It is important that we recognize that communities of color are less likely to participate in research. There are many reasons why, from mistrust due to historical abuse and misuse of our information for the sake of research and science, to trauma and structural barriers like lack of transportation, language, and communication. Among Latinos, we represent nearly 1/4 of the US population, and in some states or counties, 1/2 or 3/4 of the population, but only 1% enroll in clinical trials. Given the disproportionate and persistent elevated rates of morbidity and mortality among communities of color, which have been further magnified by COVID-19, equitable representation of Latinos, Blacks, Indigenous, and people of color in research is more important than ever. And we need to work closely with our community health workers as trusted partners and researchers to be able to advance and remedy this situation. So Brenda Lee, again, we're very excited to learn about your work implementing a community health worker model for community engagement and research. Adelante, Brenda Lee, bienvenida.
Muchísimas gracias. Buenas tardes. Good afternoon. Thank you for the invitation. I really think that is always a good time to talk about improving ways to address health disparities in the creation of new knowledge about the conditions and diseases that affect us. And right now, I just wanted to take a second to recognize the lives lost to the current COVID-19 pandemic and the countless number of people affected in so many ways. Thank you. Some disclosures that I so pertinent in terms of my relations with the Patient-Centered Outcomes Research Institute that I'll be talking about a little bit later as an ambassador, and also regarding the work of for the last 5 years in training and developing and implementing training curricula for community health workers for them to be able to participate in research. So today in the, 30 minutes that I will be speaking, and then we will have some time for questions and also to try again to get to hear Darlene. I will focus on providing some context and some definitions. It may be not new information for some of you, but for others that are joining us in participating in this discussion, I think it would be very valuable to just be on the same page. I will also discuss some of the issues with currently CHWs in direct service delivery, and then expanding that role into that creation of new knowledge I was talking about with research and specifically with clinical interventions in the US. And all that within the context and the assumption and after looking at the data that yes, CHWs can address health disparities in research with those interventions that properly and effectively incorporate community health workers and promotores. I will then move on to talking a little bit more about that training module on patient-centered outcomes research that I told you about, both in English and in Spanish, and going across 4 states where the Hispanic Latino population is substantial. And I will end up with talking about some funding tips and resources where you can find more information and of course plan hopefully your next proposal or improve on what you're working on right now. And anything with Latinos, we do have to always talk about language use and terms. Here also with the promotores and community health workers, there are several lines of thought in terms of making distinctions, and that would be another webinar, very interesting to have. But for the purpose of this work, we have, and this is coming from the usage we have in Florida of doing community health workers / promotores, and I recognize that there are differences in those definitions across the board and several states. Also, promotores and community health workers may be known as health advocates, lay health educators, community outreach workers, uh, community resource specialists, health coaches, patient navigators, depending on what angle of specialization or specific work they have on a program. And I am sure that this definition or operating definition of community health worker has been shared quite, and I think that is a good point to make because it does include several important components about what a community health worker is. And going by the American Public Health Association definition, we have several terms that are very critical in conceptualizing the role of promotores and community health workers as a frontline public health worker, which has the trust of the community or communities that they're serving. Also in their function or role as a liaison, link, intermediary between those in need and the health and social services that can help them. And in doing so, they tap into their linguistic many times and also cultural competence for that direct service delivery. Definitely, they aim to increase not only the health knowledge of the individual, the unit as a family or as a community, but also increase the self-sufficiency of the client. And you can find out more when you explore the APHA website with the link provided. And in healthcare teams, and now for the last 10 years, we have been moving to a more inclusive and team effort, not only in name, but also in the interaction of the players. We see that there's a connection with the health promotion and the actual healthcare and conceptualized as a team, with each member contributing with a specific role. And we do have that very pertinent role of connector as community health workers and patient navigators. Promotores and community health workers address what we call the triple aim, right? They improve health, and there have been several studies that revealed significant positive changes, especially in chronic disease management. Also, CHWs improve the quality of care because by providing education, service, and care coordination, and that engagement and activation of the patients or clients, for example, in diabetes, there has been a documented reduction or a percentage of diabetes patients, for example, that have clinically significant drops in the A1C levels. CHWs also reduce costs, and there has been a lot of variance in this, but definitely there are formulas already that has been work and continue to fine tune regarding the cost savings of CHWs intervention by keeping patients out of the emergency room and actively managing their chronic disease like asthma, diabetes, and others. And that's not including the prevention aspect with the education and support and even peer support that they can provide. In doing so, they contribute to decrease the health disparities that we see. And it's a struggle because many of the promotores and community health workers are also managing those conditions themselves as being part of the communities that they serve and face similar challenges. And lastly, overall, they do have that contribution to improve overall population health. We can go a little bit more in specifics on the how, because with the CHWs, they do have the upper hand in bridging language and cultural gaps that may exist. And we know they do exist, and it has been quite documented. especially now with the era of COVID pandemic, we are seeing the data regarding those health inequities in vaccine distribution and education. Also, promotores de salud, community health workers can bring experience-based expertise to the team. I tell you, as a CHW instructor, in bringing in and capitalizing on that lived experience, that with proper adjustments and care, they can actually convey and communicate with the researcher team in terms of what does it make sense to the patient, making it more of a patient-centered approach. CHW's interventions have been documented, as I mentioned, working with chronic disease management, and usually that addresses the needs of the vulnerable populations. And hopefully those patients with the greatest need will benefit from those support activities, strategies, and methods that can assist them in the self-management journey of their condition or disease. So in doing all that, I think that is an important statement to make regarding their contribution. And here it is regarding equity versus equality. Equality sounds fair, and I think this visual is familiar to some of you, in which we see that everybody gets a bike independent on their individual needs, their individual interests, their individual characteristics, and it doesn't fit everybody, versus the concept of equity, in which no one size fits all formula is expected, but rather working on a tailored connection and a tailored strategy intervention for that patient. As you see in this, you see the picture in this graph. And if you go in the literature, you see a lot of work on documentation and assistance in the works and programs about CHWs integrated in direct service delivery. Right now, at the Chula Vista Community Collaborative, where I joined just 6 months ago, we are having CHWs named under a different rubric, but they are those frontline staff members that provide direct resources and strategies and support to address food insecurity, to address a lacking of clothing, immediate referrals, processing applications. That is a very, very important role that the community health workers play. But let's not forget that some of those community health workers can and actually decide this as a career path to work and improving their skills to be part of the creation of new knowledge, more patient-centered through clinical interventions and other programmatic activities. They contribute to the best practices, which is improving the lives, not only of those immediate patients and clients, but for the benefit of future ones. That is what is defined as social justice. Here is hard to read, but I just wanted to just show you visually how much work has been documented. And this is just one team back at the University of Miami under the leadership of Dr. Olvin Carrasquillo, known in the All of Us program, among others. And the work for the last 10 years he has done in Miami with Latinos in several interventions, clinical trials, randomized controlled trials, and the work of the promotoras within those research teams. And it's just a snapshot of an intervention, of a CHW intervention, that it begins with of certain phases and assessments that research associates can do, but then in specific components such as goal setting and working with the barriers that clients, and in this case, patients or participants in the study will have. They can and actually have contributed into better understanding of those barriers. So certain mechanisms and activities can be more tailored to enhance participation instead of hindering. Also, in the actual intervention with the phone calls or creating community events on that could educate uh, participants, and inclusive of mobile-based technology. More and more, we see CHWs providing that technical support so patients can maximize the use of their devices in working in conjunction with their team of care and providing data on daily readings of their blood pressure, for example. And it does take a little bit of time, passion, and commitment for spending the extra time and working with individual patients to help them use the tools so they can adhere to the proper medication, to the protocol of the research, and that time, commitment, and energy and encouragement usually comes from a community health worker. And lastly, visits. Right now, I know that there's moratoriums and also different ways of continued contact with patients, but usually community health workers invest a lot of time, energy in working and taking the research to the patient, even accompanying them to doctors' visits and at home explaining the use of monitoring devices and being able to answer questions right there when they are needed. From that work, we were able to flesh out many articles, and I showed you several, with the Miami Healthy Heart Initiative. And within that study regarding type 2 diabetes, we were able to put together an intervention that we called in Spanish cariño, meaning love. The love that and the care that community health workers put into the relationship with the patients. The CHWs actually put together a how to book themselves to be of assistance to other community health workers that may be working and assisting patients with type 2 diabetes, Latinos, monolingual or bilingual. And they created, and I translated and focus tested the translation, and it's available for you free of charge in online. And the highlights about that intervention called Cariño or Love with the Latinos with type 2 diabetes, we found that because of the role that the CHW play, more participants were contacted and effectively reach in the first, second, and very initial stages of the intervention. Also, that it allowed for the closer monitoring by doing visits at home. Usually, doctors and nurses and other healthcare professionals cannot have the luxury to follow up patients in home visits. Also, taking the time. Those visits may take 1 to 2 hours, depending on the outcomes for that site visit. And CHWs were the ones being able to not only help them with the devices like the blood pressure monitor, answer questions, and also fill out forms, and even make linkages with other services like mental health support. Let's not forget the education that goes along and the demonstration, cooking demonstrations, learning how to read effectively a nutrition label from products in in grocery stores or already in your home, to know how to strategize and engage in activities that will be better for your chronic disease management. CHWs, promoters, and patients do assist in research, creating demographic profiles of the community, also working on your community needs assessments at your institutions, and overall being seen as community resources for those community services. And those are the arguments for declaring that CHWs are and can be your partner as major stakeholder in addressing health equity within the patient-centered outcomes framework. And let's talk more about that, because they are, as we have said, a position to help and be of assistance in very unique ways, because many oftentimes they're patient themselves. They're patient advocates, either for themselves, their family members, or clients. And they know how to navigate the system. And if they don't know, they know who to ask. For that, we wanted to properly equip and train our community health workers based on all these several interventions throughout the years. We looked around at peer and lay scientists and other types of documentation and trainings, and we put together one that was tailored to our needs, but also that could be beneficial to other community health workers, other research teams that wanted to integrate them. We put all that together in a series of sessions, back and forth, evaluations, focus groups, consultations with national experts from different states, and curriculum development experts, actual CHW instructors, and in the state of Florida, because we do have certification, we were able to present that to be accountable for credit for certification. I have a question there regarding the CHWs clinically trained. Usually, depending on the research project, they receive more specific clinical training, but they are not necessarily licensed on any particular front. And certification, it does depend on the state that you're in. Some states, they have certification for community health workers, but here, for example, in California, is not statewide. This project had not only the curriculum, but had the slides, the facilitator's guide, and the student workbook available both in English and Spanish. The content on 7 modules, from the basics of research and how it is different than direct service delivery. We go over that point very closely, because we do have to make that distinction between what is research for the benefit of broad and what is direct service provision. Ethics, they will be confronted with questions and doubts and skepticism from the community because of many reasons that we know. So they need to be able to explain about ethics and the protection of human subjects. Basics of randomization and the participation in clinical trials. Basics on data collection about surveys and questionnaires and focus groups, and even observations. Of course, the informed consent process, how to follow a study protocol that is replicable in other circumstances by other teams, data management, data collection, and once everything is analyzed, presented back to the patients or to the experts, worked on again, and published, also to be disseminated in ways that are not traditional, not only the JAMA papers or the academic circles in conferences and presentations, but also in ways that are meaningful to those participants and for the community in general, so that knowledge doesn't get lost. That's the content. Currently, with another engagement award from this funder, I am working on expanding this curriculum by adding a COVID-related chapter. And basically, with that chapter, the feedback I have received is on preparing future patients, future research participants into a more positive attitude towards the participation in clinical trials, especially in the area of COVID. Letting you know more details about the amount of people that we work with, the amount of community health workers all across Florida, with partners in California, and with partners in Texas. So community-based organizations were partners with the academic institution, in this case, University of Miami, and worked on the curriculum, provided input, provided feedback on the exercises, and actually implemented those training sessions within their own group of community health workers. There is some data here that I just wanted to share briefly, and of course it kind of reflects the nature of the beast with community health workers, the majority being women, and in these states, in white and Hispanic on ethnicity, and they were very satisfied with the attention put to them on the expansion of their role. They were very appreciative of those explanations on why do I have to get informed consent? Why do I have to go through this? It's not only a paper, it's a process. Oh, why do I have to follow the protocol as is? Because if not, it will really damage the effectiveness of the intervention. Things that they were used to doing automatically as part of direct service delivery, now they were able to better understand the rationale, the reason behind. You can get those materials available for free from the PCORI website. Here I have, they're showcased by my promotora then, and she went on and continued her education and went to higher degrees. So this is something that it may be a career path for some community health workers. That is a pathway, not for everybody, but maybe some community health workers may be interested in pursuing this. And in terms of funding, looking at an organization that is amicable to these principles of stakeholder, of engagement, of participation, and equal in participation of stakeholder partners, you can take a closer look at PCORI, the Patient-Centered Outcomes Research Institute. They do have engagement awards that are open now for sending your letter of interest. They do pay attention to the clarity of the defined roles of the stakeholders, also very clear rules of engagement, compensation plans, and the governance structure of those patient advocates that you will integrate, and of course, communication and logistical issues and evaluation methods as well. I invite you to take a look at PCORI.org. You will see there a lot of information about their targeted funding and enhancement projects for the next 3 years, their commitments on which areas of research, and ways to get involved. I started in 2014 as an ambassador by taking their training, learning more about this model, and also working, well, for free and in activities to educate myself and educate others about a more patient-centered approach to research. I was able to also participate as an advisory panel member for 3 years. And they're also merit reviewers for specific conditions and diseases. And also Now they just released learning packages for free that allow your team to get access to the lessons learned from all that PCORI funded for the last 10 years that they have put together in tip sheets, videos, on how to support multi-stakeholder research teams. You can find all that at PCORI.org. And there are some of the major players in terms of the WHO organizations that can be of assistance. They disseminate with newsletters. They do have guides and lots of resources, mostly for free, available on community health workers and their different roles, not only in direct service delivery, but research and clinical interventions. With some contact information regarding not only what the work I do in Chula Vista Community Collaborative here in direct service delivery, and also training community health workers to be more proficient in patient-centered outcomes research. Thank you for your time.
Thank you, Brenda. Thank you so much. On behalf of the Puerto Rican Cultural Center, the network of the National Library of Medicine, and our partners, we can't thank you enough for sharing your experiences and working with promotoras and the value of their participation in research. We're going to open up for questions. So if anyone has any questions or even comments for Brenda Lee, I'm going to turn it over as well to Kimberly Silva.
Sure. This is Kim. Hi, I see your questions in the chat. So we'll start with Miriam's question. Are community health workers clinically trained? And if so, in what areas?
Yes, I tried to answer a little bit of that one while I was there. And I indicated that depending on projects, sometimes there's specificity. Let's say that for those diabetes type 2 interventions, besides the data collection and all that, there was some basics on what is diabetes, what the difference between type 1, type 2, how to recognize certain levels, and that basic level of disease knowledge or condition. And there's no licensing in that sense, because as you know, the difference between a license and a certification would be that without a license, you cannot work on using that role. So CHWs are usually entry-level, mid-level staff members that are those frontline employees and public health workforce.
Thank you. And then another question. This one's related to COVID-19 and their community health workers' role in distributing vaccines and providing information about it.
Yes, I know that there has been some funding lines that have included either academic centers or other type of organizations putting together, educating first their community health workers, and not in the actual distributing that part, but yes, on the information provided in the languages that the community speak, also clarifying myths and misinformation that may be circulating in that targeted community. So I have seen them more being a part of those education efforts on COVID-19 vaccine.
Thank you. We just got a question from Wanda. How do certified peer specialists work with this organization?
So, well, there's always that distinction between what is a peer specialist and a promotora or community health worker. Peer specialists are actually members of that group that can support on that very specific content area, like on opioid, or on depression, or whatever the specialization is. And there are more certification programs on peer specialists, but not all peer specialists are promotores, in which promotores and community health workers really broaden the base on social and health services for the patient. not all promotores are peer specialists, right? Because they may not necessarily have experience. They have not been a smoker, for example. So they cannot be part of peer specialist group. But yes, they can serve on the role of promotora, community health worker by linking the patient with those peer specialists or other support referral services.
Okay, thank you. And Ida wants to know, how can community health workers help in recruitment and retention of participants of the All of Us research program, which is a national NIH study trying to recruit diverse participants to meet its goal of 1 million that will be part of a database for future studies to develop individualized precision medicine for prevention and intervention/rehabilitation. That was a
Yeah,
winded
that's a
question,
great
sorry.
question, Aida. And actually, it's very related to precision medicine and the efforts from Vanderbilt University and University of Miami. And we have been able to present, educate, and inform community health workers about those very high level concepts about precision medicine, about human genome, about the importance of representation, and not only the collection of that genomic data, but also in the answering the questions and concerns of the community. So yes, CHWs can, with the proper training and the proper follow-up as part of a team, as part of a supported team, can bring the message in a way that the community can better understand, and in turn can inform the research team on what's happening in the community, what are their concerns, and their need for more information on a given topic. So I think it works both ways to have the role of the CHW be part of such a team.
Do we have any more questions? We have time for one more. While we wait, I have actually one question. I mean, it sounded like you were very thoughtful about making sure that you were aligning the work with culturally responsive practices, like even in the name cariño, it was very much something that would resonate with community, because that's what community health workers are all about, right? Compassion and lending of themselves through service to the community. So what would you say is the secret sauce or other components of that secret sauce, or what we would say the arroz con habichuela, right? That the sazon, right? What's the sazon that you had to sprinkle on this work to make it come together and get that buy-in and support in the community?
Yes, and actually it's a very good segue to the next question on the chat regarding on how CHWs foster that self-sufficiency in the communities, because of their knowledge on that commitment and support. I think that they again worked in two directions, because we have learned, we as with the hat of the researcher and as part of the research team, we have learned a lot in our interventions, coming from the point of view, the experiences, the examples, and their suggestions from community health workers that have actually improved the implementation of the intervention by choosing names, by letting us know about possible barriers on the packaging of the instruments that we were using to collect samples, for example. They provided so much information. That's their salsa. They can see things that are in our blind spot as researchers and alert us. When with proper training, they can actually not only grow on their own knowledge, but also elevate the knowledge, increase the knowledge of the patients in a way that is more direct. And in terms of fostering that self-sufficiency, ultimately, the CHWs tell me we want to become obsolete, right? That there is less and less of a need for us to bridge those gaps. And by teaching like how to fish instead of just providing the food. And that is some of the roles that many CHWs have told me, and that I have worked with in several states in the goal of social justice and advocating for better communication, better materials, improved ways of those instruments to be developed, to be actually put together, translated properly, and in ways that make actual sense to the audience, the targeted audience that they have in mind.
Well, Brenda Lee, such wealth of knowledge that you've shared. Really appreciate it. I think you started a conversation that we can't finish now in terms of thinking through those very much needed capacity building support systems and resources. Even here in Illinois, and a lot of the work that many of us who are on this session today do, we are recognizing that need and trying to think through how to bolster that, how to create those spaces for promotoras to have networks where they co-learn and be able to support each other. So I think we started something that we're going to have to probably finish in another session. But
Totally so.
With that being said, we thank you again. We're going to now, because of time, and we want to be mindful of and respectful of everyone's time, move forward with some announcements. We wanted to share some resources again, given the fact that we have a few partners with us today sharing information about the National Association of Hispanic Nurses for the Illinois chapter. You can visit them at the link on the screen. Also, Illinois Unidos that I mentioned earlier as well. You can learn more about their initiatives. So we are actually engaging in establishing a Latino or Latinx community health worker network, and that's building and growing and driven by the community health workers with their guidance and their lens. So we're looking forward to helping facilitate that and learn from them. And also, we're still sort of in a pandemic. We're not out of the woods yet. So make sure that if you are feeling symptomatic and are concerned, that you do get tested. And also, if you have any needs for resources in terms of food assistance and support, you can visit the Northern Illinois Food Bank food pantry locator.
Go ahead and share about the All of Us program.
Okay, thank you, Monica.
Lisa. Hi, my name is Monica Rodriguez. I work for the All of Us Research Program and the Illinois Precision Medical Consortium. We are, as Aida mentioned in the chat, looking to recruit 1 million or more participants to share their health story with this program. Latino representation in research is very low, and it means that the treatments and the solutions for the healthcare problems that we face as Latin Americans are really not being addressed in the care that we're receiving. So if you're interested in learning more, this is not a clinical study, this is a research program. It's a partnership. We invite you to go to joinallofus.com. You also have the information here on the screen, and we invite you to learn more. If you are looking to be a part of the volunteer network that's helping to champion the All of Us research program and the cause in Chicago, we are looking for All of Us champions. I'll drop my email address in the chat. Please feel free to reach out. We would love to connect with you. Thank you.
Thank you so much, Monica.
And I just wanted to see, I see myself in that picture. So there's a good start in involving minorities and people of color in all the visuals in clinical research. So thank you for that.
Wonderful. And I'm also going to invite Xiomara Rodriguez. She can share a little bit more about the Puerto Rican Cultural Center and some very exciting upcoming events. Xiomara?
Hi, everyone. Thank you so much for having me, all of us in the National Library of Medicine. It's so exciting that we could do these webinars. So I am the Digital Presence Initiative Director here at the Puerto Rican Cultural Center. We have a food bank, which La Bodega del Barrio Food Bank. That's we have a food bank here, and that we service the community who are individuals living with HIV. And then they are also doing nutrition classes. We have a nutrition class series, so look out for our February and March dates. Leonie Calderon does that program. And then we have Mercado del Pueblo. So the grand opening is this Friday from 4 to 8 p.m., but we're open every Friday from 4 to 8 p.m. and Saturdays and Sundays from 10:30 to 5. And that is a community business incubator. allows folks in the community, vendors, local vendors, to sell their products there without any overhead costs. They don't have to pay rent, they don't have to pay vendor fee, and is a really beautiful place to build community, chat with each other, get some chocolate cortez with queso de bola and frituras, all types of good stuff. So definitely come out. And yeah, thank you all for being here today.
Thank you so much, Xiomara. You made us all hungry. This is a perfect time, right? We're all ready to eat.
For a snack.
Oh, one more thing, let me plug, since I'm getting y'all hungry. Those are the frituras and a little bit of stuff, but we also sell sofrito there too. And we use our products that we grow at the greenhouse at the Pedro Albizu Campos High School to make the sofrito. So if you want to be healthy, you know, you get the sofrito from Wepa.
Yes,
Good
and the
job.
school actually has been really wonderful about teaching students how to grow their own indoor gardens so that we can continue our cultural traditions of making our own sofrito at home, right? And some of our traditional Puerto Rican meals. And it's amazing that, you know, that the school has been able to do that. Speaking of cultural responsiveness, right? And you also mentioned Leonie. For people who may not know, Leonie's like iconic in the Puerto Rican community because she has been able to do so much in terms of building wellness. She was instrumental in bringing Muévete to get people more active in the community. So definitely check those events out. Thank you so much, Xiomara. And then as a quick reminder, please do go to the link and complete the post-session survey. It'll really provide us an opportunity to get some input and feedback and learn about your other interests and needs. If you have suggestions for sessions, or you think that you have a great topic that you'd like to present or facilitate, please do email us at info@tanoaconsulting.com. And we'll definitely reach out and work with you. If you want to learn more about the Puerto Rican Cultural Center, please visit the PRCC-Chicago, CHGO.org. To contact me, the moderator, you have my information there, Al Aponte Soto at panomaconsulting.com. And to contact our amazing presenter, Brendali Rodriguez, you can reach her at brendali.rodriguez@cvesd.org. Muchísimas gracias. Before we go, we want to emphasize the importance for everyone to continue to practice those 3 W's so that we can stay safe. We know how difficult it is for everyone to continue to limit contact, but the vaccine's here. So until everyone's vaccinated, sooner than later, hopefully we will regain a sense of being able to be more socially together. But until that's the case, please remember to wear your mask, wash your hands, and wait 6 feet apart. This way we can show love and respect for others, particularly those who live with you, who may be a little bit more vulnerable. And in closing, also always remember to be kind and loving to one another. You never know what someone else is experiencing within their context, their lived experience, and their reality. So it's important that we lean on love, compassion, cariño, and empathy, ¿verdad? Empatía, and together we can truly make a difference. Muchísimas gracias, Brendali. Thank you everyone for joining us today. We hope everyone considers enrolling in the All of Us project, at least checking out the information that we shared. And we thank you again for joining us today. Peace and love. Gracias.